Hi guys, this is Dr. Piracha again, and this is time for the next video. Okay, so in the last video, I had broken down the treatment of chronic stable angina into 5 different components. And I think it's very important if you think about the treatment of chronic stable angina, if you could go down these 5 steps, that's gonna make sure that you have the best way of remembering these things. The first one is lifestyle modifications. I did that in the last video. So if you haven't taken a look at it, please look at my last video, and we talked about lifestyle modification. So today we're going to be tackling the second component of treatment of chronic stable angina, which is risk factor control. So let's go through this question. We have a 55-year-old man who has a history of hypertension, diabetes mellitus type 2, and hyperlipidemia who presents to your office. The patient has been having substernal chest pain for the last 3 months. Pain is particularly felt whenever he mows his lawn on the weekends and is relieved by resting afterwards. He was evaluated by the cardiologist who performed a coronary angiography and diagnosed him with stable coronary artery disease. He recommended medical management and risk factor modification. In your office today, the patient is asymptomatic. His blood pressure is 135/78, heart rate is 75, respiratory rate is 18, and he's afebrile. His latest lipid panel that you've done just a few days ago shows his LDL is 65, hemoglobin A1C is 6.4, and BMI is 24.5. So what do you recommend for him today, now that he's in your office and he's asking for your recommendations? And so here are your answer choices. So your answer choices are: number 1, intensify his diabetic medication regimen to decrease his hemoglobin A1C to less than 6.0, or increase the dose of his statin for improved lipid control, or you're going to ask him to exercise more to decrease his BMI to less than 22, or you're going to adjust his blood pressure medication regimen to decrease his blood pressure to less than 130/80. So it's what I want you to do. You pick a choice and you write it down and you hold on to it, and I'm going to tell you what is the right answer at the end of this lecture. So the component of chronic stable angina management that I've broken down into risk factor control actually has 2 further components. One of them is blood pressure control, and the second one is blood glucose control. So let's talk about blood pressure control right now, okay? So the correlation between blood pressure and coronary artery disease is already well established. Better blood pressure control has been shown to have better outcomes in terms of reduction in the rate of heart attacks and stroke. The latest guidelines from American College of Cardiology recommend keeping the blood pressure less than 130/80 in all patients with chronic stable angina. First line medications include beta blockers, ACE inhibitors, or if the patient is not tolerant of ACE inhibitor, you can use an angiotensin receptor blocker. This is a class 1 recommendation, and that's very important because class 1 recommendations are those about which everybody has consensus, everybody agrees on them. There is absolutely no ambiguity about class 1 recommendations. The second line medications, if you cannot control the patient and you already have them on beta blocker and ACE inhibitor or angiotensin receptor blocker, you can use dihydropyridine calcium channel blockers, thiazide diuretics, or mineralocorticoid receptor antagonists. Now, this is also a class 1 recommendation, which means that everybody has consensus that if the blood pressure cannot be controlled by the medications above, then you can pick one of these medications, and as second line medications, everybody has consensus that these are the accepted recommendations. So that's your blood pressure control, and let's talk about the blood glucose control. So this is also a very well established factor that hyperglycemia is an established risk factor which enhances coronary atherosclerosis that leads to myocardial infarction down the road. However, When it comes to recommendations regarding blood glucose control, the guidelines are a little bit sketchy. There is some wiggle room in them. Some of the bodies recommend that you can target a hemoglobin A1C to less than 7.0, like American College of Cardiology. But some other bodies recommend that you should be targeting less than 6.5, mostly from American Association of Clinical Endocrinology. Here's my take on it. I will personally take a hemoglobin A1C of less than 7.0 any day of the week. It is very hard to control hemoglobin A1C. The patients go through a lot of trouble. They have to stick to a very strict diet and exercise regimen to decrease their hemoglobin A1C. So I'm not very picky about it. If I can get my patients to have a hemoglobin A1C of less than 7.0, I will accept it. And I think it's very acceptable in the current environment where obesity and diabetes is just so prevalent and controlling it is just so difficult. Okay, so I'm gonna end my talk by answering the question that I gave you earlier. So by now, I'm sure you already know the answer, but let's go through the choices again. I don't think there is any more value in decreasing his hemoglobin A1C to less than 6.0. Hemoglobin A1C between 6 and 7 is perfectly acceptable that this patient has. Also, I don't think increasing the dose of his statin for improved lipid control. His LDL level is already less than 100, and it's very acceptable at the current state. Asking him to exercise more to decrease his BMI to less than 22 is also not really a good strategy. His BMI is less than 25, and that is perfectly acceptable. There's no need to decrease more BMI. I think the biggest bang for the buck in this patient is to adjust his blood pressure regimen to decrease his BP to less than 130/80. His diastolic blood pressure is already less than 80, so we are at target there. What we need to do is to decrease his systolic blood pressure to less than 130/80. So thank you so much for tuning in today and listening to my lecture for today. So please, if you like my videos, please like my channel and subscribe to it. And I hope to see you in my next video. Thank you.